we have coffee on the table. The vodka will be coming shortly. So my job is to give a background about the Medicaid program and ACA in Rhode Island. And then I know we're all anxious to hear what Amy will be speaking with us about, because it's up to the minute what's happening in DC. So the first thing is to think about how are people insured in our state, and the majority of people still have health insurance coverage through their employer with Medicaid and Medicare, public insurance insuring a significant number of folks as well. I just want to go briefly over the Patient Protection and Affordable Care Act, which was enacted on March 23rd, 2010. And the purpose of the act was to expand access to affordable coverage. And as we'll talk about briefly, there were two ways to do that. One was to provide tax credits for people to purchase qualified health plans through an exchange, and in Rhode Island that's our Health Source RI agency, and also to have cost-sharing reductions for help for not only with the premium, which is what the tax credits help pay for, but for out-of-pocket costs for lower-income folks. And then Medicaid expansion. The second part of the ACA was consumer protections, and then the third part was also to accomplish some the reforms in the healthcare delivery system so that we can be paying more, paying less for better healthcare services, because that's what insurance should be all about, is getting better healthcare. The consumer protections, people are probably very familiar with these. Young adults can stay on their parents' health insurance plan until they turn 26. People cannot be denied coverage because of pre-existing or chronic conditions like cancer or diabetes. And as Amy will talk about, that has become one of the issues at the repeal and replace the Affordable Care Act. People cannot be dropped from coverage when they become sick or because they have spent too much on their coverage in their lifetime. There is no cost preventive care, so the ACA is all about promoting good health, and part of that was to say, well, we want to promote preventive care, so we're going to say that people don't have to pay for those services, and that includes checkups, vaccinations, birth control, and cancer screening. Women cannot be charged more for insurance than men, which had been the case prior to the ACA, and it helps seniors who get some help with prescription coverage through the Medicare program who go on and off of that coverage under current rules. The way that people would access coverage was through the Health Benefits Exchange, which is a marketplace where consumers can compare and purchase qualified health insurance plans, and also apply for programs that help pay for insurance, so the Medicaid program and qualified health plans with tax credits, and also a list of essential health benefits that had to be provided by all plans sold through the exchange and by other plans as well. So you can see the list here in terms of doctor care, pregnancy, maternity care, mental health and substance use disorder services, prescriptions, pediatric services, including oral and vision care. And think about this list of essential health benefits as well as a number of the protections, because again, those are all things that are potentially being eroded under the current replacement bill. So what did Rhode Island do? Well, we chose to create a state-based exchange, which is called Health Source RI, and we established a network of navigators to help people apply for coverage, whether that's through a qualified health plan or Medicaid expansion. So people really had an easy route if they were lower income or up to even higher income to apply through Health Source RI. The first determination was, is your income low enough for Medicaid? If yes, you get Medicaid. If no, then you can buy a qualified health plan. Oops, wrong way. I'd like to show this slide because it shows sort of the intersection of affordable coverage. So under the ACA, as I've said several times, the affordability is the tax credits to purchase insurance through Health Source RI, and assistance with out-of-pocket costs, which are called cost-sharing reductions. And then it also opened up eligibility to the Medicaid program for the first time for adults without kids in their custody. So you see the list of people here who could come through the Medicaid door. They're eligible at different income levels, so children, parents, pregnant women, elderly, people with disabilities, and children with special health care needs. But the one group that wasn't eligible is if you were a working adult, you didn't have kids in your care, you couldn't even come through the Medicaid door, even if you had really low income. So this now created, through the ACA, the floor of the Medicaid program for everybody, regardless of what category you fall into. In Rhode Island, the results of the ACA have been that 30,000 Rhode Islanders buy coverage through HealthSource RI, and the vast majority qualify for tax credits for help them pay for coverage, which means they have income below 400% of the federal poverty level, or close to $85,000 for a family of 3. But the vast majority of folks are below 250% of the poverty level, because not only do they get help with their premium, they also get help paying for out-of-pocket expenses. And that's for families with income up to 2.5 times the poverty level, or about $50,500 for a family of 3. Okay, so lots of people buying through the exchange, getting a lot of help paying for both their coverage and their out-of-pocket costs. And then we have another 70,000 Rhode Islanders, adults who enrolled in coverage, and many for the first time. It's a very low income limit for those adults. It's 138% of the poverty level, or about $16,400 for a single adult. There's no resource test in the Medicaid program for this expansion population. So who benefits from Medicaid expansion in Rhode Island? It's about 56% of the people who have come on through that, those 70,000 are men, 44% are women, and it's almost equally spread across the age bracket. So it's the younger adults who are working and don't have access to insurance through their jobs. It's more middle-aged individuals as well. And then importantly, it's also for, I hate to say older at 50 to 64 now, but you can think of older people who, who don't have insurance through their work, through their jobs, or maybe they have left their job and at 64 they're waiting for Medicare to kick in. For the first time, they now have access to health insurance coverage through the Medicaid program. So this is just a visual of, if you think of this box as the Medicaid health insurance card, we had covered everybody, and now we put in that last piece of the puzzle of the non-disabled adults age 19 to 64, or the Medicaid expansion population. So we also have, I just wanted to provide an example of Medicaid and a qualified health plan working together for family coverage. So here's a dad and 2 children. Dad earns $30,000 a year. His children are enrolled in Right Care at no cost, and as I think everybody in this room knows, Rhode Island was a leader in expanding health insurance coverage to kids. We've been doing that for 30-something years. So the kids get covered through Right Care. Dad can buy a plan for $241 a month through HealthSource RI and gets a tax credit of $141. So he's paying $100 monthly for his premium, and he also is going to get help paying for some of his out-of-pocket costs. Okay, so you put those two things together, and now we have good coverage for the family. So that's sort of what happened with the ACA and the impact in Rhode Island with the 30,000 adults through buying through HealthSource, and 70,000 adults newly gaining Medicaid coverage through Medicaid expansion. But overall, more than 1 in 4 Rhode Islanders, or as my friend Karen would say, close to 1 in 3 Rhode Islanders, receive affordable health insurance coverage and or long-term services and supports through the Medicaid program. So it's the 70,000 adults that we've seen, about 155,000 parents, kids, and pregnant women, 19,000 seniors, 32,000 adults with disabilities, both those who have intellectual and developmental disabilities, serious and persistent mental illness, or physical and other disabilities, and 12,000 children with special health care needs or who are in foster care. And of those seniors and adults with disabilities, it's not only providing them with a health insurance card, but the long-term services they need to stay in their homes, or if it's necessary to move into a more 24/7 nursing facility. This slide is just to illustrate the balance of who has Medicaid coverage and how much that population needs to use in Medicaid services. So if you look at the top, elders and adults with disabilities. 19% of people enrolled in Medicaid are elders or adults with disabilities, and their costs are 53% of the costs in the program. Naturally so, because some of those services are the long-term care services that are fairly expensive. Kids and families, 55% of the people, 23% of the costs. Children with special health care needs, 4% of the enrolled folks and 7% of the costs. And expansion population, 22% of the population and 17% of the cost. This is an old slide from, it's actually 2015 information from the last report that OHHS published about the Medicaid program. One really important part of Medicaid, as we see the federal government sort of playing around with things, is that the Rhode Island budget includes $2.3 billion in Medicaid funding. And there are different, it's a shared program with the federal government. We spend $1, we get $1. Sometimes we spend $1 and we get $9. Terrible math. That's why we get done. So our regular match rate for most of our services and populations is around 50%. 49% from the state, 51% from the feds. For the CHIP program, which is covers some higher income children in higher income families, federal government wanted to encourage states to cover higher income kids. We had already been doing it, so they gave the states more money. They said, okay, in Rhode Island, we pay for 12% of the costs, and federal government pays for 88%. Expansion population, people may know that at the beginning, the federal government said, we will give the states 100%, we'll cover 100% of the costs. And Rhode Island took the federal government up on that. The lowest that was scheduled to go was to 90% federal share, and the state paying only 10%. That's a $500 million price tag for covering those 70,000 expansion population folks. And during the Great Recession, the other way that the Medicaid program works is that as states were really struggling during the Great Recession, the federal government said, wait, we'll help you out. If you keep your folks enrolled in your Medicaid program, we will increase the match rate and we'll help the state out. So during the Great Recession, we got a 63% match rate instead of the 50% rate where we had been. So that funding formula with Medicaid is really important for the state's economy and for all of us in terms of coverage. So Medicaid funds facilities that we all use. It's important to support hospitals and nursing facilities. One little known fact is that school districts also can get federal matching funds for some of the health-based services that they provide to kids. So it's local dollars that are bringing in federal matching funds to support health services for kids in schools. And the ACA is working, right? If we measure success by the number of people who are insured, then we have seen a big success. Our uninsured rate has dropped from 11.6% prior to the ACA down to about 4%. Clearly we have a way to go because even as we're seeing more people insured, that insurance is not equally shared. I think as Heidi pointed out in some of her slides in terms of the disparities that we see, certainly in health insurance coverage and access to health care, there are significant disparities that we need to address.